So, Module 1 discussed microbes and the importance of keeping them out of surgery to avoid surgical site infections or SSIs. To truly understand how to keep the OR sterile, we must first understand the purpose of the OR within the hospital system as a whole. All current day hospitals have a specific design. This design is meant to improve efficiency and care for staff and patients. Getting patients from one area to another is considered in each design. I'd like to move through the hospital from and follow a patient through the path of the hospital and into the operating room. As we move through the description of the hospital, I'd like you to keep asepsis and sterile technique concepts in mind and how we keep microbes out of, of, of each individual area of the hospital. Okay. We are going to there it is. Okay. All right. Let's say a 12-year-old boy, Johnny Smith, has a fever and terrible lower abdominal pain. His mother and father are concerned, so they take him immediately to the local hospital. This is an urgent visit, so the family enters the emergency department. This department here is the emergency department, or ED. The ED is an unrestricted area. That's why I drew that green around the ED, which means it is accessible by patients, families, staff. Plain clothes are allowed in this area without any required personal protective equipment or PPE. In the ED, you will find doctors, nurses, emergency room technicians, as well as administrative staff such as registration. After a short wait, Johnny was seen by an emergency room doctor, and it is determined that he has an appendicitis. An appendectomy or removal of the appendix is required. After the ED, so once a person goes to the ED, they're either discharged and sent right back home, or they're admitted to the hospital. Due to Johnny's need for a surgery, he's admitted, and he is brought to an inpatient bed. Now, this inpatient bed area is probably something you recognize if you visited somebody at the hospital before. Um, this is also an unrestricted area. It has no requirements for attire unless it's stated on a patient's door. But doctors, nurses, patient care technicians, or PCTs, and many other allied health professionals can be found in this area. The surgery department, while Johnny sits and waits in this area, the surgery department will let Johnny know that they are ready for surgery, for Johnny and surgery. So a transporter will come, place Johnny on a cart, and ask Mr. and Mrs. Smith to come with him and follow them to the pre-op area. Now, the pre-op area is also unrestricted. This unrestricted area will allow families to stay with patients. So Mr. and Mrs. Smith can stay with Johnny while he is prepped for surgery. Family support is quite important for healing, to keep a patient calm. So hospitals really try to allow families to stay with the patients as long as possible. So this pre-op area will see surgeons, anesthesiologists, nurses, PCTs, a lot of staff in this area, and then also patients and family. So while Johnny and Mr. and Mrs. Smith are in pre-op, while Johnny's getting prepped for surgery, the surgical areas are also preparing. So here we have this CSPD, which is where our instruments are prepared. Okay. Now, to enter the CSPD department, we need to go into the CSPD locker room. This area is unrestricted. Okay. So anybody with plain clothes, staff with plain clothes can enter that locker room and change into this attire, this surgical attire that is required for our semi-restricted area CSPD. Okay. Now, this CSPD department cleans, packages, sterilizes, and stores all surgical instrumentation and supplies. It requires that, and you can see how what everybody is wearing here. It requires specific clothing and attire to assure that there's a minimal amount of microorganisms that are introduced into this space. Staff will enter through the locker room and into the CSPD department. They'll change into hospital provided scrubs, hair cover, and shoe covers. Only appropriately attired staff are able to enter this semi-restricted area of CSPD. There's always going to be signs or red lines on the floor that are used to separate these spaces. Anyone passing into a semi-restricted area is expected to be in proper OR attire or the semi-restricted attire and to observe the rules of the semi-restricted area. Remember, this space contains items that are used during Johnny's procedure. Improper attire could cause more microorganisms that may cause infection. Through these doors, you will find right through here, you will find the CSPD decontamination area. Now, this area will require goggles, gowns, masks. Now, personal protective equipment is more for the safety of the staff than it is for Johnny. Because right now, this staff member is cleaning all of those dirty instruments. And we'll go into CSPD in more detail in the next module. In this area, you're going to see sterile processing techs and managers that will work in CSPD. The other surgical area preparing for Johnny's arrival is the operating room. The operating room is also a restricted area that requires all of the staff to wear exactly what they wear in CSPD, but also a surgical mask. Okay, so this is the OR locker room. That's unrestricted, but then you have to put on attire, cap, mask, surgical scrubs in order to enter that restricted space of the operating room. Okay, so the OR is the area where Johnny's procedure will actually take place. So this is where it's essential. All rules must be followed to keep away all unnecessary microbes from this room. This is where Johnny will actually be opened up, and so he's going to be very exposed and vulnerable to microbes. So let's go back to Johnny. Last time we checked on him, he was getting prepped for surgery in pre-op. His parents are keeping him company as the OR nurse comes to take Johnny to surgery. The nurse tells Mr. and Mrs. Smith that the staff will take very good care of Johnny and directs the parents to the OR waiting room. Johnny is then taken into the operating room where the surgical team, an anesthesiologist, a surgeon, a surgical assistant, surgical technologist, and OR nurse will remove his appendix. After the procedure, the OR nurse will bring Johnny to post-anesthesia recovery unit or PACU. This is right here. PACU is a semi-restricted area Okay. Where nurses primarily care for the patients coming off of anesthesia. They're closely monitored until they are ready to be brought back to their inpatient room where they can be reunited with their families and wait for release. If something did not go as planned with Johnny and he needed critical care, the intensive care unit is located nearby. It's always close to the operating room. This ICU is an unrestricted area so that nurses and the specifics with ICU is that there are less patients per nurse. So the nurses can keep a really close eye on these critical patients. Um, this is an unrestricted area, so this is also where patients' families can come to visit. So Mr. and Mrs. Smith could come and join Johnny if something happened. So these are the main areas of the hospital that are related to surgery. Hopefully, this map will help you better understand the path that a patient takes throughout their care, the amount of people that a patient is exposed to throughout their time at the hospital, the amount of opportunities there are for microbes to be introduced to a patient, and then the ways that we can eliminate or minimize those microbes on the patient. Um, so you'll see that those requirements for surgical attire in the semi-restricted and restricted areas, how important they are. In the next module, we'll take a closer look at CSPD and the surgical decontamination area.